Diabetes is a common condition that affects many people around the world. It can show up in small ways that need attention. But sometimes, there are big signals that something serious is happening. Knowing these signs can help you get help quickly and avoid serious problems. Here are 7 important signs of a diabetes emergency that everyone should know about, whether they have diabetes or not. First, let's talk about fruity breath. When someone with diabetes has fruity breath, it means their breath smells sweet or fruity, but this is not normal or healthy. It happens because there are too many ketones in their blood. Ketones are made when the body burns fat for energy because it can't get enough energy from sugar due to not enough insulin. Normally, some ketones are removed from the body through pee. But when there are too many, they build up in the blood, causing a condition called ketosis. As the level of ketones gets higher, the body tries to get rid of them by breathing them out, which causes the fruity smell on the breath. Next on our list is rapid breathing or shortness of breath. As we go on, please subscribe to this channel if you're finding this video helpful. Thank you. When someone with diabetes breathes rapidly or has trouble breathing, it's not just a small issue. It's a sign that something serious might be happening inside their body. Our breathing is connected to keeping the right balance of acids and carbon dioxide, CO2, in our bodies. When there's too much acid, the body tries to get rid of it by breathing out more CO2 to bring things back to normal. In diabetes, this fast breathing often means something called diabetic ketoacidosis, DKA, is starting. DKA happens when the body can't use sugar for energy because there's not enough insulin. So, it starts breaking down fats instead, which makes acidic substances called ketones. When ketone levels get high, the blood becomes more acidic, and the body breathes out CO2 faster. This shows up as fast or hard breathing. It's not just the lungs working harder. It's the body trying to fix a very serious problem. As DKA gets worse, it can cause other big problems, like coma or even death, if it's not treated. Knowing that fast breathing could mean DKA is starting is really important for anyone taking care of someone with diabetes. It means they need to get medical help right away. Next on our list is nausea and vomiting. Feeling sick to your stomach and throwing up are common signs of being unwell. But for people with diabetes, these symptoms can mean something serious is happening inside their bodies. They might be signs of a dangerous problem called diabetic ketoacidosis, or DKA. When someone has diabetes and their body can't use sugar properly because there's not enough insulin, it starts using fat for energy instead. This creates ketones, which are acidic substances. If there are too many ketones, they can make the blood too acidic. When this happens, it can make the stomach feel upset, leading to nausea and vomiting. But it's not just about having an upset stomach. The body makes you feel sick and vomit to try to get rid of these extra acids. If the ketone levels keep going up, it can really mess up the body's balance and make the blood too acidic. This can cause problems for different parts of the body in people with diabetes. So, feeling sick and throwing up aren't just signs of feeling bad, they're like warning sirens. They show that there's a serious problem with how the body is working, and it needs to be fixed right away. Next on our list is confusion or altered mental state. When blood sugar levels go too high, hyperglycemia, or too low, hypoglycemia, it can mess up how the brain works. This can make people feel confused, dizzy, or not like themselves. For people with diabetes, long periods of low blood sugar can lead to something called diabetic ketoacidosis, DKA. DKA happens when there are high levels of ketones and sugar in the blood, which can mess up how the brain works. On the other hand, if blood sugar gets too low, it can stop the brain from getting the energy it needs, causing similar problems. These changes in how the brain works aren't just side effects, they show that something is really off in the body's balance. When someone with diabetes has these symptoms, it's important to get help right away. Fixing the main problem quickly can stop it from causing more problems and keep the person healthy. Last on our list is weakness or fatigue. When someone with diabetes experiences a profound sense of weakness or fatigue, it isn't merely the typical tiredness one might feel after a long day. It's a deeper, more concerning exhaustion that may signal an imbalance in the body's metabolic processes. Diabetes revolves around the body's ability to use glucose, the primary energy currency for cells. If glucose isn't effectively utilized, energy production can be compromised in diabetes. When insulin isn't sufficiently present or isn't working effectively, glucose can't enter cells for energy production, leading to a state of energy deprivation. This situation is like having fuel around a car, but not in its tank. The body, although surrounded by glucose in the blood, can't convert it to usable energy, causing feelings of profound fatigue.